Hi everyone, my name is Dr. Charudatt Vaity. I am Director of Critical Care at Vocard Hospitals, Mumbai Central. And today, on the occasion of World Lung Day, I am here to talk about lung and its health and how it all concerns all of us. So the most common factors which affect the health of lungs globally is air pollution, excessive consumption of tobacco, the use of tobacco, the global climate change, environment change, the change in the lifestyle and how we are living in the current era. These are all the factors which affect the health of lung globally. So individuals can manage good lung health by following these different techniques. First and foremost is try and have a healthy lifestyle, a good sleep, good rest, frequent and regular exercises which involve breathing exercises, respiratory exercises, deep breathing. All these interventions will help us with with good lung health. Apart from that, you are also looking at prevention. So trying and avoiding tobacco completely. Tobacco is harmful, we all know that. Air pollution, you can try and check the air pollution, try and improve the air quality in places where you are staying, working. That will improve your lung health. Apart from that, if you are having asthma, if you are having allergies, then making sure that you try and avoid them will also influence how your lungs will behave. So these are the certain strategies which will help with the health of your lung. So air pollution is one of the biggest problem which we are facing in this century, and it directly impacts the health of the lung. The influence it has on the condition of the individual lungs can be varied. So in people who are having normal lungs, it can cause irritation. In children, it can cause stunted growth of the lungs, and it can progress to a chronic lung condition. In patients who already have lung conditions, this can worsen their lung condition. It can progress to a more worse situation and increase their risk of hospitalization. So this is how the air pollution is impacting all of us. How can we reduce its impact? So I think we ought to be all responsible and try and follow strategies which can reduce the air pollution. So there could be government initiative of having policies which promotes clean air. We see it in Delhi about how they are using the car in alternate rotations, so minimizing the car use, minimizing the impact it has on the air pollution. So government policies are there, air quality checks are there. At individual level, you could look at your environmental air quality and try to use air purifiers in your own environment. And vulnerable people who are having lung health issues, they can use protection by wearing masks appropriately and try and minimize the impact of air pollution on their lungs. So exercise, diet, weight management, these all will have positive impact on the lung health. If I talk about weight management, patients who are having heavier weight, obesity, they are having increased tendency to have lung related issues. So weight loss certainly improves your lung function, and therefore the tendencies to get problems due to lung conditions are lesser. The same thing would apply in how we do our exercises. Exercising physical exercises, they would improve your general health as well as lung endurance. So endurance exercises, they will improve how your lung function is going to be over long run, short run, long run. So and the diet, it's going to impact your weight, it's going to impact how your body is getting built. So there is overall positive impact on the lungs by following a strict diet, doing regular exercise and maintaining weight. So the common lung conditions like COPD, asthma and lung cancer, they have varied types of presentations, but the common signs, COPD and asthma, they are like there is a similarity in way they present, but the profile of the patients are different. So asthma is more common in a younger population. Asthma, you have episodic breathing difficulties. So patient has breathing difficulty, and between the two episodes they feel absolutely normal. So that is a very important point in asthmatic. While as the COPD, that is chronic obstructive pulmonary disease, this group of patients are usually the elderlies, the middle-aged categories, and they do have history of exposure to smoking or air pollution most of the time, not all of the time. And these group of patients, as the name says, chronic obstructive pulmonary disease, they have episodes of breathing issues, but in between also they don't feel completely normal. So that is the difference between asthmatics and COPDs. And the early signs in these group of patients is generally cough, wheezing, breathing difficulty. Then you have increased production of sputum or respiratory secretions, associated fever, sometimes blood in the cough. So these are the common and early signs. Whereas lung cancer goes, you would generally see it in an elderly population, sometimes in patients who have risk factors like very heavy smoking in the past, but not always. And they again will have symptoms like cough with blood in the sputum, as well as weight loss. So this will be a progressive thing, not an episodic thing. And anybody who has risk factors, age, smoking, air pollution, or illnesses like COPDs in the background, who come in with cough, increased productive cough with blood, with weight loss, you would strongly think about lung cancer in this group of patients. So in the recent time, there has been a very progressive change in how we are diagnosing as well as treating lung conditions. When I talk about diagnostics, the quality of CT scan, the high resolution CT scans, PET scans, MRI, they have really evolved over the last decade or so, and so much so that you are able to look at the detailed anatomy and architecture of the lung. And previously, in the past, we were required to take actual sample of the lung to make some diagnosis, but nowadays the CT scan or PET scan, they can get away with without doing biopsy to make a diagnosis. So there is a great advancement in diagnostics in terms of imaging. Then we have biological markers which are evolving. We don't have a confirmed diagnostics on that end, but it's a research field which is emerging changing quite rapidly, especially in the field of interstitial lung disease, where the biological marker give us a hint on what kind of illness the patient has. Apart from that, you have improved way in doing spirometry, that is looking at the lung function tests, at home, in the hospital, and it gives us a better monitoring picture for the patients at home as well as coming to the hospital, so they are well informed. Easy availability of pulse oximetry, especially after the COVID, it helps patients to monitor their own oxygen levels at home. So there have been great advances in these terms in how we are able to diagnose lung condition. In terms of therapies, you have a great development in biologics, especially targeted therapy. Individual is assessed, looked for any specific type of antigen, and then you have a targeted therapy, especially for the asthma. There is a great evolution in terms of how you are managing asthma now, and in fact I don't see it impossible that in the near future you may have 1 or 2 doses of medications which may be able to control or cure your asthma altogether. So there is that is a great advantage there. Apart from that, the preventive strategies have also improved. The vaccination availability, especially for the flu, for the COVID, for the bacterial pneumonias. So this gives us a great advantage, especially in somebody who already has chronic lung issues, to have a preventive management in terms of getting lung infections. So there have been good advances over the last couple of decades which are helping with patients who have lung conditions. So apart from the traditional lung diseases like asthma, COPD, interstitial lung disease, the emerging and lung conditions which the general population should know is one. This is not exactly new, but which is now more awareness is there, is ARDS, especially from a critical care perspective. This situation called as acute respiratory distress syndrome is one of the things which people are more aware now. So this particular illness affects your lung in a severe form, as it says, acute respiratory distress. So this particular group of patients, they can have infection or any related injury anywhere in the body or directly to the lung, and the lung can become severely involved, so much so that these patients can end up on the ventilator and sometimes on a machine called as ECMO to support their lungs till they heal. So this is not exactly a new condition, but a condition which is now more awareness is there, especially in the medical community, and therefore to the general population. Apart from that, COVID has still been lingering on, though it is not severely affecting, but you still see some manifestations of it, which is medically labeled as long COVID. So patients who have suffered from COVID in the past, they have still lingering symptoms, and it may be involving lung or other systems, and that is one of the new things following the COVID. Apart from that, the viral illnesses which constantly evolve. Then environment related and climate related lung conditions are emerging and changing in the lifestyle, especially the emergence of e-cigarettes, vaping. They also have a negative impact on the lungs. So these are some of the new conditions which are evolved over the last 5 to 10 years. So the COVID pandemic, which we all suffered in 2020, and it sort of went on for a couple of more years, and now we are in a steady shape. It has influenced our thinking generally about the healthcare system and our own health, and especially the lung diseases as well, so I think people are more aware of respiratory illnesses, and I see a lot of my patients would be quite switched on of consulting their doctors if they have even what seems like a minor cough, cold, fever, because there is a heightened awareness of a respiratory illness causing a worsening situation. So there is more awareness following the pandemic, I would say. Then COVID itself has, as I mentioned before, that long COVID is one of the things which is still there. For the medical fraternity, it also it has changed, how we see. So the technology advancement and its utilization, the availability of internet, high-speed data transfers, it has allowed us to do teleconsultation. So that has become a big thing. So patients are able to consult their doctors on the devices, and that is something which has emerged quite heavily after the pandemic, and it gives a great advantage for the patients to consult anybody from anywhere in the world. So that is one of the biggest emerging thing, telemedicine. Then development of vaccines and availability of vaccines after the pandemic has also been quite there, and as I said, people are more aware. So the vaccination is also something which people do proactively as a way to prevent any major respiratory illnesses. Smoking, as we have spoken before, it has a direct impact on the lungs, and the impact of cessation of smoking is also quite significant. So anyone who quits smoking, they would experience immediate effects or short-term effects, and then long-term effects. So immediate effect is that the quality of life, their general well-being, the mental status, these things, they start improving straight away. The cough goes off, the breathing difficulties which someone may feel after heavy smoking, these things will start resolving on immediate basis. Over the mid-term and long-term range, the lung starts having regeneration, recovery, and the health of the lung improves. So the lung capacity, the performance improves, and therefore the quality of life improves. This indirectly and directly also affects any secondary smoking related complications which can occur, which is heart or heart disease like heart attacks or brain attacks, that is the stroke. So stopping smoking has immediate effect as well as mid-term, long-term effect, which overall will improve the health of the patient. In someone who has not had permanent damage, there is certainly big role of smoking cessation, and someone who has had like permanent, like COPDs, it is still helpful because the further damage is prevent, and therefore the progression of disease can be halted. So vaping is a new and emerging fad, especially amongst the youth, and we certainly don't understand its large and long-term impact for now, because the usage is not so much and we have not observed the whole spectrum. But there have been good number of case reports which talk about its impact on the lung health, and we do see some cases which come, so it is not something which you can say that it is safe or better than smoking. So there is a huge regulatory concern about it, because the ease with which the people are able to vape or smoke a vape, because it doesn't really cause much smoke alarm. So in places, in public places or enclosed places where generally smoking is restricted, and that indirectly has an impact on how a person smokes, the vaping is possible, and that kind of allows them to have more vaping than what they would do normally with smoking. So there is that social availability of vaping easily, especially to the youth, who are vulnerable and easily influenced. We are not very sure about the long-term impact, but certainly the nicotine which is there in the vape has impact. We know that from our previous experience with the smoking. So it's not a benign thing, and my advice and suggestion to all who are listening is that it is not something which is safe, and it's better to be avoided.